March is Women's History Month, and as we celebrate the many contributions of women, we want to focus on an important health topic that affects women. We're talking about heart disease. You may be surprised to know just how it impacts women more than men. What are the risk factors and what can be done? We welcome back Dr. Margot Vassar, a clinical cardiologist at the Queen's Heart Physician Practice in this morning's Ask a Specialist. Good to see you again.
Good to see you.
Why should women be concerned about heart disease? Isn't breast cancer a bigger issue, if you will?
You know, it's a bigger concern, but actually per capita and in absolute numbers, more women die from heart disease than breast cancer every year. And unfortunately, amongst younger and middle-aged women, those numbers are actually on the rise.
Why is that? I mean, I've seen some bullet points here, but why is that?
Amazingly, even though we know about the risk factors, women are less likely to receive counseling, be told that they're hypertensive, have high cholesterol. If they do have hypertension, they're less likely to be educated on it. And in the third way, they're actually less likely to be given treatment for their high blood pressure or high cholesterol.
Is it just because they don't seek it, or they just being moms and are just saying, well, I can get to that later? I mean,
You know, there's a combination of factors, but there's actually been studies shown that there is a bias amongst physicians ourselves, that women are more likely to be counseled on weight loss, whereas, you know, actual addressing the risk factors are less likely in women.
That certainly needs to change. I know we have an image that I wanted to show the viewers at home because there are some structural things, if you will, right?
Well, there's some other challenges when it comes to heart disease in women. Now, we know about blockages of these main arteries, and that's the main way we know about heart attacks happening. But in women, you're more likely to get what's called microvascular disease. So as these vessels branch out and it gets smaller and smaller, you can still get blockages in those small vessels, and they can be a little more challenging to treat, but that's more common in women. Women also are more common to have what's known as a dissection of these arteries, so actually tearing of the lining away from the artery wall that causes a blockage. More common in women, and it's actually a different treatment approach.
When you talk about risks, cardiac risks are very high for women as well. Can you talk a bit about that?
Well, you know, the risk factors are the same with men and men. Hypertension, high cholesterol, smoking. We also look at things like a sedentary life and poor diet as risk factors. But I think for women, there's an additional challenge, something we think of as more cultural risk factors. Women are caregivers. They actually very often will minimize their symptoms in order to take care of somebody else. And I think there's in a lot of women a built-in tolerance for pain, maybe starting from childbirth.
Oh, you got that right. Mom has a high tolerance for pain, for sure. And then you have age and family history, a whole bunch of things that sometimes our moms are so busy, they just say, you know what, again,
Absolutely.
I'll take care of it later. What can we do to prevent this?
Well, you know, just educate yourself. If if you don't know where your blood pressure is, if you don't know what your cholesterol is, find out. Ask your doctor, is that normal? What can I do to be improving these numbers? You know, you're always your own best advocate, and you know, stay healthy, stay active, quit smoking if you smoke, and all these other things.
Super moms, super women, but still find some help and ask questions.
Absolutely.
Yeah, Dr. Vassar is part of the Queen's Heart Physician Practice, which provides advanced cardiovascular care here in Hawaii. To learn more about the services they provide offered to their physicians as well, call 691-8972, or you can go to www.qhpp.com, and it could save your life. It really could. Doctor, good to see you again.
Thank you.
Thank you very much. Kelly's got an